Well, back in 2008, I was in a car accident. So at that time, I contacted South Florida, and I actually saw Dr. Husted, and he ended up doing a 3-level neck fusion. From that point on, because of my activity, I was put on pain medication. And that's kind of how my journey started, and that's how I got referred over to Dr. Ramos for maintenance. Dr. Husted did a great job. He went in there only hoping to do 2 levels, but once he got in there, there was more damage, so he went ahead and did the 3. It was very successful. I was, concerned about the surgery, but to be honest, it was way better than it could have been if I didn't have the surgery. I also recently got diagnosed with lymphedema, which is a swelling of your legs. And I spoke to Dr. Ramos about it, and he's like, you know what, I'm here to help you. Let's get you weaned down. I'm kind of a strong person, and he was going to put me on another medicine to kind of, wean me down from what I was on, but then I would have had to come off of that. So that's kind of where my journey started, where I just made up my mind, and with dedication and perseverance, I said I can do this myself. And that's literally what I did. Came off of a large dose of pain medicine, and it took me probably about 6 to 8 months. It was a struggle. I'm not going to say it was easy, because I was on it for so long. I just started a little bit at a time, kind of breaking my dose in half. Of course, with Dr. Ramos, he was there the whole time, tell him what I was doing. And then another month I do a little more. And sometimes I would slide back because, it was painful. But eventually, after about 6 months, I'm off of the morphine. And I actually did it myself. It was a struggle. It just seemed like my endorphins, or maybe like my thinking pattern, that was kind of the hardest thing, is kind of resetting back into that realm. I spoke to Dr. Ramos, and like he had said, because your body was on that for so long, and that's part of the process. So I still have good days and bad days. I'm not going to say it's been perfect, but like I said, I just keep trying and just thought of the big picture. And my lymphedema is still there, but it is more controllable. So that's kind of really most of it. I mean, my pain has increased, but I'm just trying to decide, I may have to go back on something at some point, but it'll never be that dose. And, I'm just trying to maintain a good lifestyle with either no pain medicine or maybe just a little bit. I would definitely recommend him. Dr. Ramos, he really takes time and he listens, and because when I told him my idea, he's like, really? He's down to earth, if that's the way to say. It's like layman terms. He just makes it real easy. Even like Dr. Husted, when I first met him, I thought, you've got to be kidding me. He looked like he was 25, and doing that major surgery, just like Dr. Ramos. But really, I mean, I would highly recommend him. I've obviously gone on, Google and all that, but I mean, he's really saved my life, in my opinion, and obviously Dr. Husted as well. But Ramos is always, very supportive, and it's always like an open door policy with him. I make my appointments. I'm always seen within 10-15 minutes. I also do use the Port St. Lucie office as well, because I'm kind of like, in between. And there it's the same way. Everybody's very receptive. I feel safe, I will say that, because with the COVID and everything, it's the temperature checks, and that's important, especially when you're at a doctor's office. I would definitely recommend South Florida Orthopaedics as like the one starting point. There are so many doctors here, all specialty fields and to me that's really important, like, some do the neck, some do the hands. So I would definitely refer them here, and that would start their journey. And then if you do have to go on pain medicine, there is Dr. Ramos, and he's highly qualified, and he really understands and listens to the patient, looking at their needs as well. If I could, mentor anybody or just like give my advice, if you're thinking of coming off of pain meds, obviously you have to be under a medical doctor, but you can do it, if you really want to do it, if you have, perseverance, that will to want to, because that's, you see a lot of people and they stay on them for years, or they increase them, or, you can do it. I mean, I'm testimonial to that. I did it.